we run the risk of having excess deaths from the same measures that we're using to try to avoid deaths. And I wrote that paper again several months ago, trying to put together a list of potential causes of excess deaths that are not due to the virus or the pandemic, but would be mostly due to the response to the pandemic that we are assuming. And I can spend hours on this, but I want to discuss a few aspects that create this excess wave problem. Number one, deaths from dysfunctional health systems. In OECD countries, this is knowledge that we had before the pandemic, 21% of premature deaths less than 75 years old in men and 30% of premature deaths less than 75 years old in women can be attributed to dysfunctional health systems. In countries of low and middle income, 8.6 million deaths per year are attributed to poor health, 5 million deaths or non-use of health services, another 3.6 million deaths. This is knowledge that we had before the pandemic. So now we have these dysfunctional care systems that suddenly are asked to deal with an extra problem where we are shifting all the attention. All these people, we tell them to go to the hospital. And people don't go to the hospital for other things, like heart attacks. We knew that many people died at home for heart attacks that could be treated, and they went to the hospital for COVID-19 at a time when we had nothing to give them really other than oxygen that they could have taken at home. Deaths from poverty and starvation. 9 million people die every year from starvation. And this includes 3.1 million young children. One child less than 5 years old dies every 10 seconds. So now we ask countries that have this problem to lock down. And people cannot get out, they cannot work, they cannot get food. And they're starving. And we're saving lives, or so we think. According to Oxfam, 619 million people in 2020 faced food insecurity, of which 135 million were in severe stage of hunger, and this number may have doubled to 270 million with the pandemic and the measures that were taken. According to the World Labour Organization, 305 million full-time jobs were lost due to the pandemic and measures taken, pushing an extra 500 million people to or below the poverty levels. You can add to that the consequences of climate change, of war, of instability in many heavily affected countries, and you can see a real disaster that is much, much bigger compared to what COVID-19 could have done. Smoking. This is really what I have to scream. We have almost 10 million deaths from smoking every year. It may be a bit less, but it's going up. And we are estimating 1 billion deaths in the next century unless we do something. Half of them are people who are less than 70 years old. They are not really old people. And for a smoker, the chance of dying from smoking is estimated at 2/3. 2 out of 3 smokers will die because of smoking. Half of COVID-19 deaths may be due to underlying diseases due to smoking, in fact. So do you want to count them as COVID-19? I count them as smoking, actually. I'm biased perhaps, but this is what I count them. Now, the tobacco industry is making money out of this. It's making about 1 trillion billion in its market value. It's growing at 2% per year. It kept growing, probably a bit more, during the pandemic. In Greece, it offered, I think, 50 ventilators because of corporate responsibility, or something like that. Reputational push. The pandemic smeared scientists and glorified the tobacco industry. Completely ridiculous. So I wrote that paper with Prabhat Jha a few months ago in Lancet Global Health, where we argued that this is a unique opportunity to eliminate the tobacco industry entirely. Just think about it. Overnight, with no voting, with no change in constitutions, with no anything, someone said, I'm shutting down everything. I'm shutting your job, I'm shutting your workplace, I'm shutting your school, I'm shutting your church, I'm shutting your opera, I'm shutting everything, but not the tobacco industry. So I would say, if we can shut down everything, just shut down the tobacco industry. Just do something right. So if we do that, since public health can do that much, I would argue we can save 1 billion lives in the next century. Mental health. Well, people in the audience probably don't face mental problems. This is why they're here. But most people faced mental health problems during the pandemic. We have multiple surveys around the world that suggest we had doubling and tripling of the rate of mental health problems during the pandemic. And same thing for anxiety, same thing for depression. Some countries did a bit better, others did worse, but overall, we had a major, major problem. I see some of my colleagues celebrating, suicides did not go up that much. You must be kidding. You must be kidding. I mean, you wait for someone to commit suicide to be happy or not to be happy. We have solid evidence that 0.1% of the population died with or from COVID, probably mostly with COVID, and 50% of the population just got nuts. Just compare the numbers. They're multiple log scales off. Education, lost years and lost lives. 90% of students around the world had their education disrupted. Data from the Netherlands, that is a country that has the best infrastructure, the best connectivity, can have laptops and infrastructure for practically almost all students to be able to continue by Zoom or from a distance their quote-unquote learning, showed that during the lockdown, students learned next to nothing. Actually, the poorer students regressed 60% more than wealthy students. It was a wonderful way to create more opportunities for the wealthy and for the privileged, and to destroy those who were disadvantaged. And in the US, it was not just education. These children had to go there to get food to live. So it was a massacre. I think it was a public health blunder of the top magnitude, probably the worst in the last century. According to UNESCO, 24 million students, including 8 million studying in universities, will not be able to return to their studies after the pandemic. In the United States of America, according to a study by Christakis that got completely attacked, more than 5 million lost person years from closed schools in the US in the first wave occurred, which is far more than the loss of life from coronavirus. Could the study be wrong? Could it have flaws? Every study has flaws. Can we correct that by 5-fold? Yes, maybe, who knows? Even then, it is a tremendous burden, and it cannot be compared with any benefit that we would get.